In the news, that GPs have voted in favour of industrial action and take a look at what it could mean for patients.
Now, the British Medical Association has told surgeries that they can choose from a list of actions to take, and they include GPs limiting the number of patients they see daily to 25. Some GPs have said that currently they are seeing more than 40 patients a day.
They could also refuse to carry out tests and assessments for hospitals before or after treatment, and they could ignore guidelines on rationing treatments. They're in place to allow the NHS to prioritise the most in-need patients. The BMA says it's up to GPs to decide what to do. Well, before the ballot results were announced yesterday, we spoke with Dr. Mohit Mandiratta, who's a GP. He's back with us now. Doctor, very good morning to you, and thank you once again for sharing with us. And people may remember yesterday you told us very clearly, and you're happy to do so, that you voted in favour of this industrial action. The question now that we have had the vote is, what will that mean for your patients in terms of what changes?
Absolutely. Good morning to you both as well. Yeah, I think the real message here that I would say is that this isn't a strike. So general practice will remain open. Patient care will be provided. If you are unwell, get in touch with your general practice. You can contact 111. You can contact urgent treatment centres. I think the BMA has made it clear that it is up to practices to decide exactly what they do. I know the headline quote is the 25 patients a day, and that is what is widely regarded as a safe amount of patients to see in a day. Demand far outweighs the capacity that general practice has, and that has been the case for years. Access has not been perfect in general practice for years. So we are on the same page as patients. We want to deliver a better general practice. We want to support the hard-working staff who are struggling in front of the frustration that they're getting, understandably, from patients. In terms of our practice, being very honest with you, we haven't had a conversation yet as to exactly what that will look like. I know conversations are going on around practices across the country. It may be a stepwise approach that practices take. That limitation to 25 patients may not be something that practices do straight away. They may look at some of the other things you've mentioned in terms of potentially clunky referral pathways, potentially investigations that they may have been asked to do that could be done elsewhere. So it is up to practices to decide exactly what they do. Some of the suggestions from the BMA have been around data sharing, around, activity at the practice in terms of telephone activity, online access. So, perceptibly for a lot of patients, they may not actually notice that anything different is happening, but that is on the backdrop of a very, very stretched general practice service, which, as you said yesterday, it is on its knees.
Yeah, when you see the comments of the Health Secretary, Wes Streeting, urging you as a GP to reconsider this work to rule, what do you say?
I understand his position, and I understand the role he has to play. But I think, this isn't a new issue. This is something I actually met with the Health Secretary when he was in the shadow cabinet over 2 years ago now, as part of a rebuild general practice campaign that I'm part of, having these very same conversations. I think, again, there's a perception, of course, COVID and the pandemic has increased, the pressures that we're under. We know about secondary care waits that obviously fall on primary care services. I've talked about the demand versus the capacity. I know you mentioned, I on a Monday will regularly see more than 45 patient contacts alongside all the other things I do, such as supervision, such as, clinical letters, investigation results. So this isn't a new issue. I know where he stands, but I think something really has to change because the profession is burning out. GPs are leaving, practices are closing down, estates need investment. So something really has to change. And again, the big message...
Yeah, sorry, Doctor. I know you're not here as a spokesperson for the BMA this morning. You're a GP. But some people might be thinking, we've only just got this new government. Wes Streeting is brand new in the job. I mean, do you, as a member of the BMA, as a GP, do you know if a conversation has been had between the BMA on behalf of GPs to take this action now? I mean, this new government has just got their feet under the table, and you're calling this industrial action. Are you concerned as a GP that you haven't even given the government a chance to do something prior to the action starting?
This message has been raised for many years with the previous
government.
Not
with this administration.
Not with this government. However, the first referendum that took place from the BMA regarding the new contract that had been released was around March time, and that had a 99% rejection of the contract because the funding was far below what we need in general practice. 90% of patient contacts that take place in the NHS are in general practice on about 7% of the budget, and that is a reducing fraction. So that took place in March. From what I'm aware, conversations were had with the Shadow Health Secretary, as well as the Health Secretary at the time, with regards to this. And obviously the results of the ballot came out yesterday, and we had a 98% call to action. So I don't want to quote this because I'm not in direct contact with the Health Secretary, but I'd be very, very surprised if the whole health department wasn't aware that this was going on, because we have been raising this for years.
Yeah, I really appreciate you sharing the experience and obviously talking literally in practical terms about what will happen in your practice as best you know it. Thank you very much, and we'll speak to you again, I'm sure.